This is Ask Dr. Amy with Dr.
Hi,
Amy.
everybody.
We're going to go over a very important topic today, and that is weeks 0 through 4 after hip replacement surgery. So pretend someone, Dr. Amy, pretend someone had hip replacement surgery yesterday, and we're going to be talking today about their experience through those first 4 weeks, okay?
Okay.
All right, let's start out. Let's get it going. Let's start out with restrictions and precautions. During the first 4 weeks, what kind of restrictions do patients have, and what sort of precautions should they take?
Great question. First of all, I want to say to you, congratulations on your journey. Congratulations on making a big decision to change your life and help yourself get out of pain. So bravo, you made it through. Good job. And now you're on the road to recovery and getting your life totally back. The 0 to 4 weeks is a really pivotal transformational time for you. One of the things that will happen the day of surgery is you will leave the surgery center with a walker. The walker is designed to help you feel safe and secure as you get acclimated to your new hip. Most patients that we see and we treat in our center, by day 2 to 3, have ditched the walker and are usually walking on their own within the first couple of days, or sometimes with the use of a cane, but very, very rarely. Typically, most patients don't need anything after that. We don't encourage using crutches because most patients that have hip replacement feel much more stable using the walker. So we actually recommend that, and you'll leave that the day of surgery. By the time you come back for your post-op visit at day 7, most patients, the typical patient, will walk in carrying their walker in one hand or sort of using it as a cane as they're walking in, and then walk out without it. So that's what you can expect the first week. The first few weeks really after hip replacement are designed to make sure that we keep the inflammation that's going on as part of the healing process in your body, that we keep that under control. So there are certain things that we'll be asking you not to do. We're going to ask you to basically be a couch potato for the first 3 weeks after your surgery, which doesn't mean, being in bed 24/7. We'll get into that in just a minute. But for the first few weeks, we ask you to really take it easy and let your body heal. That's first and foremost.
That makes perfect sense. So couch potato, first 4 weeks. When you look on the internet or when you talk to people, there's all kinds of advice about different exercises that you should do. Some physical therapists have you kind of standing on your walker and sort of moving your leg, abducting it and flexing and extending it. What, for the minimally invasive surgeries that are done that you guys do at Phoenix Spine, the anterior hip replacement and the superpath, what exercises do you recommend during that first 4-week period?
That's a great question. And the answer to that comes down to the fact that the minimally invasive approach that we use, actually, there's not any physical therapy that's required for the first 3 to 4 weeks, which is really an advantage, I think. Patients don't need to do anything afterwards. They're often pleasantly surprised that there aren't any requirements for the first few weeks.
Yeah, that is very noticeable, isn't it? It's I'm amazed at the number of patients who don't even want to take any medication. They just feel like the kind of groggy, constipated, yucky feeling after taking medication is worse than what they were feeling, what they were taking the medication for. Has that been what you've noticed as well?
Yeah, that's very, very true. Most patients that I talk to on their post-op calls are, I haven't taken anything since day 2. Like, I would rather deal with the pain and just use some ibuprofen than deal with the other side effects of taking the opiates. So I want to say, I think it's roughly 80% of our patients actually do not take any opiates after hip replacement surgery.
Yeah,
So,
that's fantastic, especially for people who might be concerned that, unfortunately, a lot of people have had problems in the past with opiate medications, and those people know they're just not going to be able to take them after surgery for fear of getting addicted again. Those
mhm.
people really don't have to worry about that under your system, do they?
No, they don't. And as a patient, I've had patients tell me right up front during the free second opinion call, I don't want any opiates afterwards. Is there anything else I can take or anything else I can do that's not an opiate afterwards? And we do have some really great options for pain relief after surgery.
Okay, well, you mentioned inflammation, and a lot of people are talking today about the relationship between diet and inflammation and your gut and your biome and all these kinds of things. Do you have any specific dietary recommendations, or is it just kind of the general, high protein, low carb, whole foods, heal up kind of thing?
Yeah, there aren't any specific dietary restrictions. However, I just think it's really good practice, just for your own health and well-being to practice a higher protein, lower carb diet, more of a Mediterranean fresh fruits and vegetables diet. Though that type of diet in general is a lot less inflammatory. It's easier on your gut, it's easier on your body, and easier on your system when your body is trying to heal itself. So that just general recommendation there. Just pretty simple stuff.
Yeah, some of the things with diet after surgery, everyone wants to do what they can. But if you look at kind of the really badness that can happen, if you're diabetic and your sugar's up, you're much more likely to get a wound infection. So you could kind of infer from that if you're that higher sugar, higher carbs are worse as far as wound healing goes. And then for whatever reason, the element arginine is strongly associated with wound healing. So you don't want to shoot yourself in the foot and be deficient on some weird thing like arginine. So why not just grab a bottle of multivitamins right before surgery and take one a day or whatever's indicated until afterwards. And then we know that low deficiencies of protein are associated with wound problems, wound healing problems. So it makes sense that high protein diet would overcome the deficiency and probably be the way to go, right?
Oh, totally. And I would say, for those of you that are watching this video and you need surgery, why not start doing that stuff now? Like why not start before your surgery date, 2 or 3 weeks or a month before if you know you're going to go into surgery? Why not set yourself up for success before? You can do all those things now. It's not going to hurt you and it's absolutely going to help you. So why not start and be proactive about it rather than worrying about it after the fact. And then after the fact, it's just already become part of your routine ahead of the game. So you're kind of ahead of the game a little bit.
That definitely seems like great advice, great hack right there. Well, long story short is there's not much going on in those first 4 weeks. It's ditch the walker, couch potato, swear off the meds, start being active 8 minutes out of every 60 at least, so you don't get a blood clot, and eat a good healthy diet. And then I assume preview of coming attractions. Asked Dr. Amy. Next time we're going to talk about weeks 4 through 8, and there are some exercises we're supposed to do. All right.
Yep. There are some things you can do. As you said, the best thing the first 3 weeks, 3 4 weeks is set your timer on your watch or your phone, your microwave, whatever you have. Set your timer to get up every hour and walk around. This helps reduce blood clots, which can be one of the complications of any surgery. Right? We want movement. Movement helps blood flow, and we want to keep that blood flowing. The other little hack that patients I tell patients to do when you are being a couch potato is just pretend like your feet are little flippers. You can just move your feet up and down. That helps your calf pump your calves. That will also help the blood flow and reduce your risk of blood clots as well when you're not up every 8 minutes, an hour walking around.
Definitely a good hack. Just keep that blood pumping, keep things moving, and probably feels better too, right? You don't want to
Hmm.
be all stuck in one position and and what have you. Well, I'm excited to hear the rest of the story. We'll do the next video will be about that 4 to 8 week period, and then the final video will be the 8 to 12 week period. Oh no, not final, then 8 to 12, and then a final one, which is sort of after 12 weeks and for the rest of your life. So we're all looking forward to hearing what you have to say, Dr. Cannatta, coming around the corner, but the first 4 weeks, take it easy.
I'm so excited.
Talk to you soon.
All right. Thank you.
Bye now.
Bye.